My name's Allegra Boccabella. I'm a third-year medical student from Bond University in Queensland. My remote experience started in 2012. I was on a gap year and I can't really remember why I decided to do it, but I wanted to experience something different. So we had a family friend who was an ear, nose and throat surgeon who did specialist outreach in the Cape York in Queensland. And so I asked him if I could come along for a trip and he said yes. And I'd be coming along as the audiological assistant. So I did that and it was a week long and I absolutely loved it. It was great and I managed to convince him to let me go again. And so it's been 4 years now and I've been up 6 times into a whole bunch of different communities. So I've been into Arakoon, Pomperau, Kawanyama, Lockhart River and Napranum. And basically the setup is that we have the ear, nose and throat surgeon, the practice manager, an audiologist and an audiological assistant, which is me, that goes up in the group. And we basically fly into Cairns the night before the clinics start. And on the morning of the first clinic, we get up nice and early and fly in a little plane from Cairns Airport to the first community. And then at the end of the first clinic, at the end of the first day, we fly back to Weipa, which is another remote sort of centre. And we stay there overnight. And then on the second day, we fly from Weipa to the second community and we'll do a clinic for the whole day. And then at the end of that day, we fly back to Weipa. And then on the third day, we fly from Weipa to the third community and fly back to Cairns at the end of it. And then we come home the day after. The first thing would be that you're really working under a strict time frame, and not to say that things aren't busy in urban hospitals, they definitely are, but in remote areas when you're flying in and flying out of a community, you have to be finished by a particular time at the end of the day so that you can fly out. So there is that time pressure to make sure that you've seen the children, or because most of our patients are children, or seeing the patients and have everything done within that time frame. So I think that that is quite different. Another thing that's different is the investigations and the sorts of things that you can actually do. In a big urban hospital, you can send someone for scans and you can send someone for tests and you can send them for small procedures. But when you're actually making those decisions in a remote area, you have to factor in how far away is that test? Does that person have to fly to Cairns? Is that flight 3 hours? How much is that flight going to cost? And other things of, does this patient really need this, or can we make do with something else? So there's a certain sense of compromise that you wouldn't see in a larger sort of tertiary hospital in a city. And I think another thing is the distribution of staff that you see. So for some of these smaller communities, it'll actually be a small primary healthcare clinic, and often there won't be a single doctor in the actual clinic. So you'll have a mix of Indigenous health workers, nurses, nurse practitioners, and other staff. You'll also have a lot of specialists that fly in and fly out. So they'll just be there for the day, just like we are in our specialist outreach team. And I think that that's really different because you've really got that different team dynamic, but it's also smaller and a lot more friendly. So you do see, you get to know a lot of faces, you see people regularly, and sometimes with the fly in, fly out, you'll actually fly into one community with a group and then see them 2 days later at a different community. So it is quite fun, and you do end up on a similar circuit. And I think that in an urban context, even though you will see the same sorts of people every day, the camaraderie isn't the same as you see when you're in the remote sort of fly in, fly out circuit, and that is quite exciting. Make sure that you bring toys with you, particularly plastic ones that you can easily clean, because often you're dealing with lots of little kids, and certainly in ear health that is something that we deal with a lot. And so you need to be able to have something to entertain the kids, and the parents are happy and you're happy and the kids are happy, and also stickers and that sort of thing, and just sort of having that with you at all times means that if you do have a patient and you are a bit nervous, you can make the atmosphere a lot less tense and you feel more comfortable, and you obviously build rapport at the same time, so that's quite good. The second piece of advice I would give would be to really make sure that you walk in and introduce yourself to all of the local staff that are working in the health clinic. So whether that be the nurse, the Indigenous health worker, the doctors, or even the cleaner, the locals really do know so much about their community, and it ranges from just practical questions about have you seen this child to hey, I didn't really know if I could ask this patient this question, or they looked at me a bit strangely when I said that. Is that okay for me to say? Often I've found in all of the communities that I've been to, they've been really, really helpful and always really happy to help out whenever you ask. And it is important to remember with these clinics that for a lot of these communities, they have different health services coming in every single day, and sometimes people come in and can be short and not very respectful that this is their clinic. So they often appreciate the fact that you've made the effort to introduce yourself and get to know a little bit about them. So I would definitely say do that, because it's the respectful thing to do, and also they really help you out when you need them. Third piece of advice would be make sure that you're really open with the parents and the community in general. So ask questions, be happy to be there, be enthusiastic, and don't be worried about sort of getting out of your comfort zone and doing that sort of thing. If you talk to the parents, if you ask them questions, if you join in on their jokes, that's going to make you feel more comfortable, and that's going to make the experience much better for you. We were on a clinic up in, I can't remember the community, I think it was probably Arakoon. But basically there was a gentleman that came in with a large sebaceous cyst, and the option was that we sent the gentleman to Cairns or that the surgeon did the operation that day. And I think I was first year medical school, really excited. But I'd actually never seen a procedure like this done before, and the surgeon sort of said, oh, we've got a medical student, let's get her in. So I got to stand in, and just before he was like, it's okay, it's going to be good. But I've done this surgery so many times, so this is not a big surgery, so I want you to be able to see everything. This is really going to be something exciting for you. And so I stood in there and watched the whole procedure, and he was asking me questions and drilling me. And as a medical student, that's a moment you sort of dream about for your entire life until you get to that point. And being in that situation where it was just me, him and the patient was so special. And actually I'd never considered doing surgery up until that point. And then we got to the end and I thought, yeah, maybe I could do that. But I think if my first experience was in a big hospital with a whole bunch of nurses, a whole bunch of doctors, a whole bunch of people in the room, I wouldn't have felt as comfortable, I wouldn't have been able to see so closely, I wouldn't have been so involved. And so that really was a really special experience that I don't think you can get outside of the rural and remote experience. My first experience seeing remote Australia was probably the biggest life-changing moment in terms of my experiences with rural and remote health. I was raised in Brisbane. I'm a self-confessed city girl. That's something that I really like, and I'd never been anywhere like that before. If you want to see the social determinants of health in practice, then going to a remote Indigenous community is a really great thing for you. It can be really, really sad, and I certainly found that it was really sad. We live in Australia, which has so many great things to offer, and we have this huge inequality in terms of health and educational outcomes with Indigenous Australians. And yeah, you hear about it and you read about it, but it's so different to actually seeing it. And the communities that we go into, some of them are classified as being the most disadvantaged communities in both the state and Australia. So you really do see a lot of poverty. You see issues with hygiene. From the moment that we actually got off the plane and went to the health clinic, you could really see it. You could see that the houses were run down. Some of the places didn't have doors on them. There was a lot of pollution. There were a lot of mangy dogs running around, and they looked quite sick. And then when you got into the clinic, I remember that there was a scabies outbreak at the time, and so a lot of the kids had scabies. There was a lot of, I saw a lot of head lice, and not that you don't see these sort of things in Brisbane or in urban context, you do, but it was much more prevalent there. And so that really changed my world. And certainly with a lot of the kids, you saw that they were quite sick, and you could really see that there was a disparity in health. And also another thing that I remember is you didn't see a lot of really old people. And I didn't really understand why until I was actually driven from this first experience to go and study public health. And then I learnt that I didn't see any old people because Indigenous Australians don't tend to live till they're very old, particularly those who live in those remote communities. And so I think it's quite interesting that my first experience was my most life-changing. My plans are to be involved in remote health for the rest of my career at varying levels. So after studying public health, I definitely have a strong interest in that side, and I really do hope to go on to become a specialist, and I hope to participate in specialist outreach, similar to the outreach sort of model that the ear, nose and throat surgeon that I've worked with does. I don't want to be an ear, nose and throat surgeon, so it will be something different, but I definitely hope to be able to do that. And I wouldn't mind doing some time even before that as a registrar or as a training doctor, doing some remote work and maybe some work with the Royal Flying Doctors in the future as well. And I also would like to get involved in health policy, particularly in terms of remote and Indigenous health. I think I do have a reasonable understanding of what it feels like to be on the ground, and not many people have that experience of actually being in those communities, being a doctor, and then also having the policy aspect of it. So that's sort of a bit of a dream. I don't know how much of that I'll actually get to be involved in, but definitely I would absolutely love to continue going on with the specialist outreach, and really can't wait until it's me there in the doctor position.